So much of this has been geared toward trying to make sure the healthcare systems don't get overrun, and keeping the rate of hospitalizations down, keeping the rate of ICUs down. What are you seeing right now when it comes to actual usage of the healthcare system?
That's a really, really good question. So COVID, people being infected with COVID and overrunning the hospital system was the original problem that we were dealing with. We had our last surge at the beginning of December, and that's really dissipated out and continued to gradually dissipate. So the hospitals in the region are starting to open up their different rooms again. They're closing down some of their COVID units because the numbers are going down. As far as the vaccination process, it's a little bit of the opposite. We are prepared and ready to vaccinate more people than we are right now. And we have the manpower and the ability to do that. We just don't have the supply. So the other was a little bit of, being overrun. And this one is, sort of waiting for more people to come that we can get as we get more vaccine.
I wonder, though, if some of the pressure is off, some of the heat is off the healthcare system in terms of demand, does that have a danger of breeding complacency that, hey, this is now under control? We can start to go back to life much closer to normal.
That is really, really good question. And I think, we're seeing the numbers continue to go down even after the holidays. And I think part of that is vaccinating the healthcare workers, which then keeps them at work. So they're not as likely to get infected and be out of work. But I also think that people have kind of come to peace with masking, distancing, and hand washing. And the federal government's stronger message around that, I think, helps a lot. So I think those are all intertwined to why we're seeing the numbers kind of staying stable. And we're not seeing any sign that people are getting complacent with increased numbers at this point.